So, good morning, good afternoon, and good evening. Thank you for participating at this webinar, Strengthening the Public Health System for Maintaining Essential Health Service During the COVID-19 Pandemic, which is coinciding now with the 74th World Health Assembly of the WHO, which is targeting on the subject of ending this pandemic, preventing the next, and building together a healthier, safer, and fairer world. I would like to thank all the participants to this webinar from all across the world, and I think that you'll be working through a very important subject today. Today's focus is healthcare workers. For all those people who have been going through the hospital, either for COVID testing or who has been actually put in their bed due to COVID-19, I think that you might very well know what is the importance of healthcare workers, especially in these very stressing moments of pandemic. However, a scientific review found that 20% of people who are working in the healthcare sector experience depression and anxiety during this period. And 39% of healthcare workers had prevalence of insomnia during the pandemic era. Hence, the 73rd World Health Assembly has designated the year 2021 as the International Year of Health and Care Workers. I think this is a duly respect, however, is a subject that is not fully dealt yet throughout the world. Today, we have speakers from public sector, academia, and the private sector who will be sharing the current challenges faced by healthcare workers, and they will be sharing with us also best practices as well as new methods and innovating approaches to solve those challenges. I would like to thank for this timely event that has been organized by the International Cooperation and Development Fund of Taiwan, as well as Good Neighbors International, or Korea-based NGO, and Dimagi enterprise that is based in USA. Before we start the webinar, I would like to give you some housekeeping rules. First of all, if you have any question, please click the link below your YouTube channel, addressed as Slido, and please clearly name who you would like to ask your question, and as well as put your name and where are you from and which organization are you working with. So with no further delay, I would like first to open the floor to His Eminence Timothy Hsiang, who will be giving us the opening remark for this webinar. His Eminence Timothy Hsiang is the Secretary General of TaiwanICDF. His Eminence, the floor is yours.
Distinguished moderator and speakers, dear colleagues and friends, good day and welcome. I'm privileged to deliver the opening remarks at this webinar. On behalf of the International Cooperation and Development Fund, I would like to greet you all for joining us today. It has been a very difficult time since the COVID-19 pandemic broke out in the early last year. As the reported cases and deaths caused by COVID-19 have continuously hit record high around the world. According to the pulse survey released by the World Health Organization, about 90% of responding countries have reported one or more disruptions to essential primary care services, and nearly half have scaled back at least one vital public health function or activity. Therefore, how to maintain essential health services and provide sufficient support for frontline health workers is an important issue we have to address. Globally, the pandemic is still growing exponentially and has created many challenges for countries, health and care workers. Health and care workers are suffering both mentally and physically due to heavy workload or shortage of resources. Recognizing the dedication and sacrifice of those on the front lines, WHO has designated 2021 as the International Year of Health and Care Workers. The campaign highlights how we can protect, invest in, and work together with health and care workers in fighting this pandemic. The TaiwanICDF is the professional foreign aid agency of Taiwan and is a member of the international aid and development community who have been responding to global development trends for many years. During the pandemic, the TaiwanICDF has integrated its project resources to support Taiwan's allied and friendly countries to fight against COVID-19. In parallel to WHA, the TaiwanICDF has held side events every year since 2018 with valuable partners, and this year is no exception. Through the side events, we not just addressed how Taiwan has been dedicated ourselves to the global health system, but most importantly, we are actively working with the rest of the world to fight the pandemic. In this urgent time, we keep standing with our partner countries because we know they will give us a hand when we are in need. Before closing, I would like to take this opportunity to express our appreciation to Good Neighbors and Dimagi for co-hosting this webinar. With the cooperation between our three organizations, I believe today's discussion will offer valuable lessons on strengthening the public health system during the COVID-19 pandemic. Again, I thank you all who are devoted to global public health cooperation. Thank you.
Thank you very much, His Eminence Timothy Hsiang. And I think that this very timely event organized by ICDF Taiwan, and especially putting forward the exemplary role that Taiwan has been playing through the pandemic, gives us a very much fruitful thought throughout this pandemic that is not yet over. So, to introduce myself, my name is Marcellino. I'm the representative of Good Neighbors International Cooperation Office in Geneva, and I'm its Chief Humanitarian Coordinator. I'll be moderating this session of webinar where we will have different experts from the public sector, the academia, and the private sector who will be sharing a good knowledge and expertise on how we deal with the stress that healthcare workers are facing, as well as the exemplary roles that those organizations they are working with has been putting forward. So, with no further ado, I would like to first invite our first speaker, Dr. Philip Loh, Deputy Director General of Center of Disease Control of the Ministry of Health and Welfare of Taiwan. I would like to thank him to be in this webinar despite being so busy fighting against COVID. Dr. Loh, the floor is yours.
Thank you. Good morning, good afternoon, good evening, ladies and gentlemen. First of all, I want to describe the interesting twist over the past 1 month. 1 month ago, when you see the lives in Taiwan, it was like nearly normal. Before April, Taiwan has never been in lockdown during the pandemic. School, shopping malls, large gathering remain open, and we only require masks wearing on public transportation. The border has been open to citizens and non-tourists. Only we used the 14-day quarantine very strictly, which was required since mid-March last year for all entry passengers. Unfortunately, because of the good time of Taiwan, the public in Taiwan seem to be complacent about confident about our control efforts. So the vaccination program, although started in March, the uptake of the public was not good during March and April. People were suspicious about vaccine side effects, and they don't want to be the first among the first to receive vaccine, which I'll describe a little bit more later. We launched our travel bubble with Republic of Palau in April, and since we're seeming so happy during that time. But after 1 month now in May, we are in semi-lockdown over the past one week. The story began with a UK variant outbreak among airline crew and their quarantine hotel staff in mid-April. and the spread of that outbreak further into the center of Taipei City and leading to widespread community outbreak in the metro area of Taipei. So on the right-hand side, you can see our case count has quickly escalated to more than 4,000 already. And we have more than 400 domestic acquired cases on a daily basis. On May 15, the government announced that we have to enter into stage 3 restrictions, which is semi-lockdown. People are still allowed to work, still allowed to go out, but school has been closed since late May, and all the restaurants and vendors are only allowed to have takeout without dining in, and most of the shopping malls are closed now. So what happened dramatically over the past more than 1 year was we had very, very little cases over the past 1 year. Until recently, we have a high escalation of the outbreak in northern Taiwan. Now you can see that we have estimated 29 deaths, mostly over the past 2 weeks. The severity rate, the percentage of our severe cases over the recent outbreak was about 10%, but as high as 20% among those who are elderly, about 60 years old. Of the outbreak but we had similar experiences 18 years ago when SARS outbreak occurred in Taiwan. We were pretty happy over the past months when the SARS outbreak finally began to enter our hospital systems in late April 2003. The outbreaks in hospitals during that time lead into more than 300 confirmed cases, 73 deaths, including 11 deaths among healthcare workers. 18 years ago, when SARS outbreak occurred. During that time, there were some major crises, including shortage of face masks, poor quarantine management, inadequate healthcare and laboratory capacity, and also poor media handling, and also discoordination among government sectors, and also heavy stigma towards patient and the frontline workers. So after SARS, painful lessons have been learned. After 2003, a lot of the strong political commitment was made to ensure that infrastructure be ready when something like SARS or COVID-19 comes back to haunt us. So over the past decades, we have established quick and early intelligence system to capture information related to outbreaks, especially outbreaks in China. Strong and centralized command system was established too, and our major priority is to prepare and protect our healthcare system and healthcare workers to make sure they are safe in a working environment and they are protected against these pathogens. And also we ensure that clear, daily, transparent communication will happen when something like this happens, so we can win the public trust effectively. For example, healthcare system was heavily reformed during that time. All hospitals were required by law to hire infection control specialists, and they secure their income. Taiwan CDC can also designate any hospital for isolation and treatment, ensure the training, allowance, and also compensation. We also fully cover costs for isolation and the care, so patients don't need to worry about their hospital bill. And also media are required to respect patient confidentiality. They cannot chase after a patient to report their stories, and they cannot disclose personal identity of patients, otherwise they would be punished by law. So because of the system, especially the early warning system, we were able to capture a very early social media message about the outbreak in hospitals in Wuhan, even as early as the last day of 2019. After that, we were very, very vigilant to start our rapid response and collect more information about what's going on in Wuhan, and we even sent 2 experts to visit Wuhan, where they confirmed human-to-human transmission has already happened there. before they even report that to the WHO. So we were quick to establish our command center even before our first case arrived, and started our daily press conference since then. One, I think the major advantage of Taiwan is because we are an island country. We're able to protect the people from the disease by strict border control measures. Something that I think is very, very important for our success previously was the quarantine management and technology. Here you can see all the incoming passengers on arrival. They are asked to fulfill the quarantine system, and also the information will be immediately linked to our civil and health services. All the passengers will be required to go to their designated place, such as their home or their quarantine hotel, for the 14-day quarantine management. And their smartphone will be linked to our system, so we can exchange information with them on a daily basis, asking do they have any fever or other symptoms, and also monitor their presence by linking the cell phone signal to the police-linked digital tracking system. If they get away from their cell phone signal range of the designated location, police will be immediately activated to chase them down and make sure they are going back to the quarantine system safely. In terms of case management, because of our previously prepared healthcare system, we had a lot of isolation rooms to accommodate those confirmed cases. All the confirmed cases was hospitalized for isolation and treatment, and they are being treated by healthcare workers, even including asymptomatic cases. But because of the current outbreak, we have a heavy caseload recently. We quickly established quasi-health institutions for mild and symptomatic cases during the current outbreak in order not to overwhelm our healthcare system and also not to overwhelm our healthcare workers. I think the change was similar to what happened in South Korea and also in New Zealand. So I just put a table here for comparison. A little bit about our surge up capacity during early phase of COVID-19. Here you can see after SARS outbreak, we already set up almost 1,000 negative pressure rooms around the country in those 22 primary response hospitals and also more than 100 secondary response hospitals. So when a big outbreak happens more, we were able to activate those 137 primary and secondary response hospitals, evacuate all the patients quickly, and change those hospitals into SARS only or COVID-19 only hospitals to accommodate the heavy case numbers. Capacity mobilized during early phase of COVID were listed here, but because of the current outbreak, we further mobilized more capacity. So now we have quickly established more than 4,000 quasi-health rooms around the country to support the northern Taiwan case counts. And also more than 3,000 isolation rooms were evacuated to accommodate only COVID patients. And also we allow cohort care to increase the accommodation capacity. And we have also activated those primary and secondary response hospitals, so patients can be still centralized in some of those smaller hospitals. So our bigger hospital can still run their business to treat other patients rather than just serving COVID-19 care. We are also in the process of mobilize up to 700 ICU beds only for COVID-19 patients, because we noticed that the severity rate of this outbreak was pretty high. So we are trying to mobilize those beds for accommodating severe patients, even though they are mostly centralized in northern Taiwan, but we use all the country's efforts. So when those ICU beds are ready, we'll decentralize the severe patients to every single city and county in Taiwan. So other healthcare workers can still participate in the care of those patients. And also, we also mobilized more laboratory to do the PCR testing and also rapid tests. So just a quick conclusion that I think we learned from SARS 2003 that no pain, no gain. We learned from mistakes that preparedness is key, and we have to use legal and financial infrastructure to make sure that the system is ready for something like SARS or COVID-19. But still, we have challenges ahead that the current community transmission is pretty heavy. We are in stage 3 now, but the containment seems to be low. So we have further announced that the stage 3 restriction will be extended to mid-June, and more control efforts will probably come in to restrict people's movement in order to quickly reduce the overwhelming caseload recently. But all the efforts are trying to do is protect healthcare system and our workers. So at the moment, our vaccination rate for the whole country population is only 1.3%, but we are expecting more and more vaccine this month and next month, and healthcare workers will be prioritized, of course. At the moment, about 50% of our healthcare workers are vaccinated, and we are hoping to achieve 100% by the end of June. So that's my presentation. Thank you.
Okay, thank you very much, Dr. Lo, and thank you for sharing your very precious time at this challenging moment. But I think that the case of Taiwan and the reaction of Taiwan to COVID, despite the challenges that you're facing nowadays, remains still very valuable and very good best practice for all the audiences and all the people who are participating here in terms of tackling maybe the next wave. And I think it's good to hear that you have already 50% of vaccination covering your healthcare workers, so the frontline workers can really deal in a safe manner with the issue of COVID and the pandemic. So now that we have been sharing the best practice of Taiwan, we would like to switch a country, and I would like to introduce you to Professor Hoon Seong Lee. He is the visiting professor of School of Public Policy at Kyunghee University in Korea, as well as the visiting professor of Global Health, North Korea Health Research Institute in Yonsei University, and a very important expert in public health in global development in Korea. He'll be sharing with us the challenges that healthcare workers are facing and how to tackle with that based on the case of Korea. So Professor Lee, the floor is yours. Over to you.
Thank you very much for the kind introductions. Indeed, it is really great honor to be here today, and my pleasure to be here, especially because Taiwan, along with Taiwan, Korea had been also globally noted together with Taiwan about its prompt response and some of the success. But we are always respected how Taiwanese counterpart has managed very well. So it was really nice to hear. Also, I used to work in Korea CDC, and then I used to work in KOICA, Korea International Cooperation Agency, which are both counterpart of TaiwanICDF and ICDF. So it is quite a really meaningful occasion for me to be presenting. So I will talk about regarding focus on the challenges healthcare workers are facing. But before that, I will briefly go over how Korea had been responding to COVID-19 situations and some of the implications for global COVID-19 efforts. So Korea's response for the COVID-19 was in 5 words, responding to the cases, early detections, treatment of the COVID-19 cases, and treatment of the non-COVID-19 patients, and quarantines as well at the point of entry. Especially regarding the responding to the cases and early detection and treatment of COVID-19 cases had been laid out as especially the 3 key aspect of the Korea's response. So this was actually key approaches for Korea. So as for Korea's response, there had been some of the outbreak waves. We had currently about 3 waves, but it had been dealt into some manageable degree. But lately, with the 3rd waves, there had been some difficulties in maintaining but it had not escalated. But one of the hallmark of the Korean response was very prompt and fast decision making from the very early on, especially after since after the first case, there had been level of response had been raised, and then the level of the response had been raised for the fourth level by February 23rd, and then there had been rapid expansion of the scope of testing, and also rapid decision to make the use of the treatment living treatment center, which is non-hospital based facility to take care of the COVID-19 patients. But there had been other measures that had been taken place as well. As for the testing, Korea had been responding similar to Taiwan to prepare the testing capacity from the very early on. And then they very quickly expanded the testing capacity with accumulated testing institution of about 118, which is similar to Taiwan. And then there had been about 600 sites for sampling those patients. And then there had been also use of the driving through sample collection and screening cleaning as well. And one of the hallmark of the Korean response probably was a very aggressive contact tracing strategies, which is actually very traditional contact tracing approaches with epidemiology investigation. But there had been additional use of the phone location information, credit card transaction log, and CCTV as well. And all of this contact tracing and confirmed cases, movement or location information had been quickly shared with the general public, either through government's text messaging service or through some of the websites that had been developed by private citizens as well to share the information. Additionally, for the confirmed cases, besides using of the hospital and ICU beds, there had been high level of the use of the residential treatment facilities, which are non-hospital based treatment care facilities, which provided a minimum level of care and then actually worked as an isolation center as well, which was actually serving the purpose of both isolation, but also relieving the overloaded capacity at the hospital facility as well. Additionally, at the point of entry, there had been use of the smart quarantine information system, which was put in place after the MERS outbreak. So, as I said, the hallmark of the Korea's response was test, trace and isolate and treat. But additionally, there had been the benefit of having the national health insurance, probably similar to Taiwan, which kept the cost of the treatment and the cost of the testing very low to the private citizens. And also there had been heavy approach of the social distancing and use of the mask. And use of the innovative solution and ICT technology was in the very high degree. But more importantly, I think there had been timely policy decisions and rapid and bold execution of those policies. But all this actually came into action very quickly, especially because of Korea's experience of the MERS outbreak in 2015. So with this, there had been no border closure, no lockdown. And Korea had been able to respond to the situation with relatively open and transparent approaches. But still, we are dealing with the third wave of the outbreak. So Korea is still continuing to respond. So there had been some additional raising of the 5-tier level social distance systems. So there still we are in a high level of social distancing phase, which is right now in 2.5 phase. And with the latest surge, there had been additional testing center established, especially in Seoul, in metropolitan Seoul areas. But as for the taking care of the healthcare worker, there has been some of the key steps which had been in place from the very early phase of the outbreak response, especially beginning with the response in Daegu area, which had the first surge of the COVID-19 outbreak in Korea. So the first one was reorganization of the regional healthcare systems with especially for the risk stratification and triage systems and rapid expansion of the beds for the isolations. And also there has been additionally there had been hospital level intervention as well with the hospital entrance and emergency room department triage enhanced, and also there had been a universal mask policy and comprehensive use of PPE. Additionally, for the specific measure in the response to the challenges, universal testing and contact tracing of the people in the long-term care and psychiatric hospitals were one of the essential approaches as well. So as for protecting the hospital, there has been enhanced measure for the entry of the hospital and movement of the patients in the hospital. And there had been facility and patient room assignments for the confirmed cases, with especially with at the healthcare facility assignments of the patients. The patients had been stratified, triaged to the 5 severity level. And then those patients there have been guidelines to direct managing of those patients according to this severity assessment. And as for dealing with patients in the hospital areas, there have been various types of negative pressure, pressurizing the wards, hospital wards, and then use of the PPE for the healthcare personnel, and also triaging system of labeling patients' severity and situations accordingly. But with the second and third phase of the surge of the patients, there had been expansion of designated COVID-19 treatment facility as well, with a makeshift ward facility, and additionally transforming existing hospital wards for the COVID-19 response purpose, with the additional training of the healthcare worker for especially using of the PPEs. But globally, as for the challenges to the healthcare worker in COVID-19 pandemic, there had been issues of delayed recognition of the COVID-19 symptom and lack of experience, and also exposure to large number of patients in long shift, and also lack of personal protective equipment in many countries, and also lack of measure to prevent the rapid spread. And on the right is how the amount of the mask and gowns and goggles and gloves that are in need globally. So to respond to the situation, some of the approaches that WHO has been suggesting was training healthcare workers to recognize respiratory diseases and to increase the access to the personal protective equipment, and to support healthcare workers as well, and also establishing strong hospital surveillance system in any case as the confirmed cases and infections are happening at the hospital, and also recognizing that every healthcare system has a gaps, and continue the response system. But there had been also the important aspect of the COVID-19 impact on the healthcare worker, especially in the mental health, with the high level of anxiety and depression and insomnia, with the consequence of increased rate of illness among the healthcare workers, and operational trouble at the health facility, and personal consequences with the lack of motivation and reduced enthusiasm for the jobs. But also to respond to this kind of mental health situations, there had been many of different approaches that had been laid out for the help seeking and delivery of the treatment service, and detecting psychological distress and mental illness. Among many of the approaches, there had been psychological support that had been tried out in the different countries, but also there had been a wide use of the innovative technologies, including digital health. But still, there are additional challenges that are facing that healthcare workers are facing with the COVID-19 situation, with the physical assault, psychological threats, and use of the weapon against the healthcare worker in some countries, and even sometimes a denial of the public health service as well. But also there have been some of the challenges in the low and middle income countries, especially in a continent like Africa, with the additional needs for the protecting healthcare workers with the lack of PPE in those areas. With this, there had been some of the important aspect of the utilizing less specialized healthcare workers, such as community health workers. As for some of the response from the Korea, especially from the good neighbors, there have been some of the response for preparedness and recovery and response. And good neighbors had been present in 39 countries against COVID-19 with mask distribution, hygiene kits, and personal support, and test kit support. As for some of the specific example, there had been some of the support in Bangladesh. Especially there had been support for healthcare workers who are working on the MCH service, maternal and child health. So providing PPE, personal protective equipment, had been very important. And also, especially educating those community health workers who are visiting even to the household level at the village, had been a very important aspect of the response as well. Thank you very much.
Okay, thank you very much, Professor Lee, for this very informative session about, the process to which Korea has been tackling the issue of COVID-19, linked with the stress as well as the challenges that Korean health workers face, as well as health workers in other countries, especially in Africa and Asia, Bangladesh and Africa. And we could see that there are different challenges that they have been facing, from stress up to the lack of personal protective equipment, PPEs. That being said, I think now we would like to go toward Dr. Lee Pai-Poo, Deputy Secretary General of TaiwanICDF, will be leading us toward how those challenges were met in the context especially of Taiwan, and how protection of healthcare workers for safe healthcare and delivery was implemented in the context of the work of ICDF. Dr. Lee, the floor is yours. Please make it within 10 minutes if possible. Thank you very much.
Thank you, Moderator, for your introduction. It is a very great honor for me to present the protect the delivers the protection of health worker for self-health care delivery. This is the outline of my presentation. The first section about the TaiwanICDF. The second section, we utilize the public health project to help fight the pandemic. The third section, the sentence. The TaiwanICDF was established in 1996, and the goal of TaiwanICDF is strengthen international cooperation, enhance foreign relations, promote economic development and social progress, and human well-being. The TaiwanICDF has implemented the wide array of international cooperation programs designed to help ally and friendly countries to develop their economic and social sector, reduce poverty, strengthen human resource development, expand agricultural productivity, strengthen health system, and reduce after natural disaster. Since our establishment, we have also built and strengthened the cooperative relation with the numerous international organizations, regional agency, and NGO. The key area of prioritize agriculture, public health and medicine, education, information and communication technology, environment and small and medium enterprises, SME development. Currently, we have 94 ongoing projects in 30 countries, 22 technicians and 149 staff in the field. Today, we will focus on the issue of public health and medicine to show the Taiwan ICDF work in this field. The Taiwan ICDF public health objective covers several things, including maternal and infant health care, non-communicable disease prevention and control, health information system enhancement, and emergency response. We aim to work with partner countries to further strengthen their healthcare system. Currently, we have 10 ongoing public health projects in Africa, Latin America, and the Caribbean region. Recently, WHO just released a second round plus the surveys 1 year after the start of the pandemic. The results show the 94% of 135 responding countries have declared health services disrupted, and 1/3 of the health services have been affected. How to maintain essential health services is an important issue for every country as well as for our public health project. WHO's first survey report show about 67 of a country use community communication to overcoming health system disruption, and 40% of a country use the telemedicine deployment to replace in-person consult. These two approaches are used by the Taiwan ICDF Public Health Project to support other countries to reduce the impact caused by COVID-19 pandemic on health service. Our public health projects are implemented through three main intervention methods at the government, health facility, and the community levels. In response to the COVID-19 pandemic, the Taiwan ICDF used the community communication and the telemedicine deployment approach to integrate project resources rapidly to provide assistance for the different level of health systems in our partner country. At the government levels, we have conduct video conference and a webinar to share and exchange experience with various countries and under different contexts. The Taiwan ICDF has also helped to review partner country policy document on COVID-19 prevention and control for further improvement. At the health facility level, we have provided training and materials for healthcare personnel in order to help health facility strengthen their infection prevention and control process. We have utilized ICT application for healthcare personnel. In the community level, we have worked on raising health awareness for the public through media and deep left. We also, by providing trainings, the sanitizer and fabric mask for the community health worker. I would like to share four examples how we have utilized our public health project to help fight the pandemic. The first is the health information management efficiency enhancement project in Paraguay, phase 2, which they jointly implement with the Taiwan Hospital, Cases General Hospital, and the Paraguay Ministry of Health. The COVID-19 pandemic has affected people's willingness to go to health facility as appearance in the sharp decrease in the number of monthly patients in April 2020. To address this issue, we address teleconsultation and patient care function in the health information system under the project. This function allows health facility in Paraguay to provide outpatient services remotely, which not only lower the risk of health care, associates infection, but also allowed patients that need to regularly refill their prescription. For example, due to Crohn's disease, the normally obtains medication and meets their medical needs. From the end of the May of 2020 to the end of the April 2021, a total of 49,190 patients received outpatient services remotely. This new teleconsultation and patient care function developed by the project can effectively help healthcare facility improve their efficiency and follow up on the chronic disease patient. As COVID-19 continues to spread, it will further highlight the benefits offered by the health information system to medical institutions and many hospitals in Paraguay. Those thus look forward to introducing the system as soon as possible. The second example of a maternal and infant health care implement project in the Kingdom of Eswatini, also phase two. This project is jointly implemented by the TaiwanICDF to Taiwan Hospital, Jiayi Christian Hospital, Hualien Chiji Hospital, and the Eswatini Ministry of Health. The project provides liquid soap to 5 cooperating hospitals in Eswatini and taught proper hand washing techniques during the pandemic. Additionally, we also enhance the capacity of healthcare personnel and provide them with the personal protective equipment, sanitizers, and masks in order to maintain the function of maternal health services and improve infection control in health facilities. The project team allocates resources to donate medical equipment and environment cleanup regimes. This action increases the ability to help workers to protect themselves and lower the risk of infection for the pregnant women and children during the hospital checkup or the childbirth. The project team also raised awareness of cell management through the radio and the monthly health columns in the newspaper. This activity followed the pregnant women to continue to seek antenatal care services in the safest environment. We can see this from the graph, which shows that the number of ANC services was not affected by the pandemic. The third example is the project of strengthening the system for the prevention and treatment of CKD in Nicaragua. This project is jointly implemented by the TaiwanICDF, Far Eastern Memorial Hospital, and the Nicaragua Ministry of Health. Since non-communicable disease patients are high-risk group of severe COVID-19, the project developed and provided the material to guide patients and distribute correct information by well-trained medical staff in the social medias to raise the awareness of the self-care. This activity helped to reduce the burden of a healthcare professional. A total of a number 397 health education activity on NCD and COVID-19 are held. The last example, our provision of assistance to vulnerable groups in Lebanon in response to COVID-19 and the economic crisis. The TaiwanICDF showed the spirit of humanitarian assistance by jointly implementing the project together with the Policy Center for International Aid. We aim to help Syrian refugees, vulnerable groups in Lebanon respond to COVID-19 and the economic crisis in Lebanon, as well as the damage caused by the massive Beirut explosions in August 2020. The project assists with the implement standard of operating procedure of a primary healthcare facility for COVID-19 infection control. as well as furnishing such facility with personal protective equipment. Now I want to share through this project, we have learned valuable lesson. It's an essential tool respond profoundly to establish partnership with various types of the organization exchange, experience and leverage resources. In addition, proactive approach in adopting new application after the COVID-19 pandemic to assist partner country move towards recovery and achieve the sustainable development goals. It is also important that COVID-19 control strategies must be in balance with other essential health priorities like ensuring the infection prevention and control measures are in place to protect health worker and patient safety. Together, we can build a more resilient and sustainable world. Thank you for your attention. Thank you very much.
Thank you very much, Dr. Lee, for overarchingly showing us, the very diverse fronts through which ICDF have been providing support to country they're in need of this health support, both during COVID and pre-COVID era. And I see the extensive work that ICDF has been pouring throughout international society. Now, last but not the least, we head toward the private sector. I think during the COVID-19 pandemic, the role of a private-public partnership and the very innovative roles of the private sector has been really crucial in fighting against COVID, both not only in the development of and production of PPEs and the vaccines, but also in the production of different platforms as well as softwares and mechanisms to deal with this public health issue. And hence, I would like to introduce you to Dr. Neil Lash, Chief Strategy Officer of Dimagi Incorporated, who will be giving us how modern technology and software improves the efficiency of delivery of healthcare and protection of healthcare workers in the larger context. So, Dr. Lash, over to you.
Hi, everybody, and thank you very much for that kind introduction. And it's really an honor to be on this panel. And I've already learned so much from hearing about these very impressive and comprehensive strategies to address COVID-19. It's great to get to tell you about the work that my organization, Dimagi, has done during COVID-19. It's a different kind of role. We weren't trying to implement a comprehensive strategy to address COVID-19, but instead provide digital technology to help other governments and organizations implement parts of their strategies. Dimagi is a digital development organization. We've been around for about 20 years and have been focusing on providing digital solutions for frontline workers, primarily in lower and middle income countries, to help improve their service delivery and empower them. And if you go to the next slide, you'll see that the primary way we've been doing this for about the last 10 years is to build and help organizations use the ComCare platform. ComCare is a digital global good, meaning it's an open source platform that is targeted at underserved populations. It's one of the most widely used platforms for equipping frontline workers in lower and middle income countries with mobile applications. Last year, we had over 700,000 active users. And a key approach we take, and very relevant for COVID-19, is that we have a very flexible platform that allows for rapid building of digital solutions. In today's language, this is called a no-code platform, meaning that non-programmers, anybody can go to an online interface and build digital solutions from scratch. We allow fairly sophisticated applications, so everything works offline. We support case management and tracking things longitudinally. We have a lot of support for customizing to local languages and powerful workflows. And so these functionalities were very relevant when the pandemic started to hit. If you go to the next slide, you'll see some just overall statistics of how our platform was used during COVID-19. So over 45,000 individual people or users used COVID-19 apps built on ComCare in over 40 countries across more than 80 different programs. We shifted quite a lot of our effort into it. We estimated we had about 50 people working on COVID-19 specifically, which was about a third to a fourth of our organization. We grew during the year to meet some of the demand. And a report from Johns Hopkins found that our platform was one of the two most useful for these use cases in lower and middle income countries. And if you see the graph here, it kind of looks like a lot of the COVID-19 graphs. In this case, it tracks the number of forms submitted through ComCare apps designed specifically for COVID-19 response, so just new apps created for this in 2020. And each form submitted roughly corresponds to an interaction between a health worker and a person that is captured. There's about 30 million forms submitted over the course of the pandemic, and you can see the trend over time that it peaked in January. If you go to the next slide, you can see one of the ways that we achieved those results, which was that as soon as the pandemic hit, we made ComCare free for use and hosting for COVID-19 specific apps through May of 2021. So that's this year. We're working with a few groups to extend that as needed. And then what we really started to do was build a series of template applications or reference applications covering a lot of the important use cases that were emerging. We had worked in the Ebola outbreak in West Africa in 2015, and so we had learned about contact tracing then. So we took that as well as protocols put out by the World Health Organization and built an example contact tracing application. We also built example port of entry screening applications. And these are digital applications to support human efforts, so human contact, people calling other people for contact tracing, not digital to digital, people doing port of entry screening or quarantining. We built a facility readiness app. We later added a application to help health workers manage to treat people at home for COVID-19. And excuse me, so we built all these template applications. We made those free. People could download them and adapt them and use them. And one thing that became apparent was just like how much demand there was for digital. Even if you look back at Ebola, there was some use of digital technology to address the Ebola epidemic in West Africa in 2015, but a lot of things were also done on paper. There was questions about like where to use digital. Here, from our experience, and we saw from a lot of these talks, for a lot of things, if you're doing a large testing program, a large contact tracing program, if you want to run these at scale, a large quarantining program, you often, everyone we talked to at least really wanted some type of digital solution to help manage those large scale endeavors. And then one lesson that we found, which is that, you might hope that you could like build a simple contact tracing application that follows the right protocols, and then, lots of countries could download that application and use it mostly as is, or with a few small tweaks. But instead, what we found, which wasn't too surprising, but it's a good reinforcing lesson, is that almost all these template applications required a lot of adaptation to really get substantial use. So maybe more than 50% adaptation to actually deploy them in a way that was useful for a country. And so the template applications were useful. Organizations were able to take elements of that and incorporate them. We were able to take them as a useful starting point, but they do require a lot of adaptation to become useful. If we go to the next slide, you'll see one thing that we were also very proud of, which was a lot of the work that we had invested over the last 10 years paid off in ways that we would hoped it would, but it was gratifying to see it happen, which is that, as I mentioned, ComCare is this no-code platform. So we had It doesn't require software developers or Dimagi staff to build new applications or update applications. And so, hundreds of organizations were using CommCare on their own to build their own applications over the last 10 years, for a wide range of things, for HIV care, for maternal care, for non-health things like agriculture. And all the capabilities they built into CommCare and all the capacity to use it, really came into play for COVID-19. Lots of people took our template applications and built their own applications, or organizations that had existing CommCare applications that were used by their health workers could quickly add a few questions to get information about COVID-19, or add a few key behavior change, communication points to those applications, and quickly get information out. And so it was really great to see, even like we were like scrambling to build new applications and things, but a lot of our partners and users were able to adapt CommCare both to address the COVID-19 pandemic, as well as to just continue their routine work. We did a little examination in April of 2020. We looked at about 250 CommCare applications that had been built just that year. And we thought, oh, these will all be COVID-19. Everything new people are doing will be COVID-19. But only about 23% were actually COVID-19, and the others were just routine applications, routine monitoring and evaluation, additional health services. All that work had to continue, and it was great to see it continue by all of our partners pushing them forward. And then one observation or lesson we'll make is that it's really good to use tools you're familiar with if you can. So when we would talk to organizations that were using some other digital tools, and if they could get most of what they wanted using those own tools, we wouldn't recommend that they would switch to CommCare, even if it was a little bit better, because in an emergency, it's if you have to build something new, you can, but you'll be able to do a lot with tools you're familiar with and know how to really get the use out of them. So if you go to the next slide. I'll just briefly talk about one thing that was kind of new for us. As I said, we mostly have worked in lower and middle income countries, even though we're headquartered in the United States. But for the pandemic, as you know, hit the United States very hard. And a lot of the work we had done to build a flexible platform that could work rapidly was pretty useful in the United States. So we ended up very quickly being involved in the early places hit in the United States and California in building digital systems to support manual contact tracing, and then built these out eventually to support some of the larger efforts like New York State, Colorado, New Jersey. And we were kind of gratified to see that our platform was useful for this case. And also all this work has allowed us to get more funding and investment, which we could then reinvest into our platform and work in lower and middle income countries. And if you go to the next slide, I'll just finish up by giving two brief examples of projects. There are a lot of projects like this, but this gives a sense of what they are. This first project shows the kind of benefits of working with a long-term partner, but in a new geography. Dimagi has worked with Terre des Hommes, TDH, for a long time. We've worked with them to build very impressive systems in Burkina Faso for treating childhood illness. But they were also working in Jharkhand, India, where we had started to work with them. They identified the needs of the local health workers. They really understood the capabilities of CommCare and the gaps that it might fill for the local health systems, which involved implementing a digital solution that would work for triaging and screening of patients. We put a lot of infection prevention and control best practices and information into the digital app, as well as some new technology. We built a conversational agent that was used by antenatal midwives, nurses, and medical officers, both to improve the care of their patients and then to keep the health workers safe and prevent the spread of the pandemic further. There's been a very well-received project combining a lot of elements of kind of local needs plus powerful digital technology and the ability to rapidly implement and scale things. We're hoping to expand the functionality to, for example, include vaccines and to scale up to 140 primary healthcare facilities, both in Jharkhand and in Bihar, and covering over 600,000 people. I'd like to thank TaiwanICDF for the funding that made this possible. We really look forward to working with TDH and TaiwanICDF further on this. If you go to the last slide, I will just briefly talk about one of the things we're working on a lot, which is starting in November. We saw that even before the vaccines were coming, it was clear that there would be a massive challenge of equitably delivering the COVID-19 vaccines. We started building our solution back in November with Rockefeller Foundation funding and have been able to scale it with J&J Center for Health for Innovation funding. Our first group that we've worked with was the government of Somalia. We worked with the World Health Organization's regional team and the government of Somalia to very rapidly adapt our vaccine solution. This helps track every dose from when people first become eligible to when they get their first dose to capturing adverse reactions, adverse events, as well as when their second doses become available, knowing who to give them to and tracking to make sure that happens. Just in a few weeks, we were able to launch our system, and it's already tracked over 65,000 doses, and that will go up as more vaccine becomes available. This is a nice example where we were able to put enough into the base solution that actually required less adaptation in governments that we've worked with so far to roll it out, maybe more like the 10 or 20% we were hoping for. So with that, and my last slide, I'll thank you very much, and I look forward to the discussion.
Thank you very much, Dr. Lesh, and also thank you everybody else for all the other speakers for giving a very diverse picture that completes overarching, image about how both the public sector and the reaction from the government as well as the private sector is channeling their diverse efforts, not only domestically but internationally, to provide support to those in most need, as well as to protect and to enable our healthcare workers to function best. Now we have about 10 minutes of discussion. I think our team from ICDF have been just collecting the different questions from Slido. I'll go on a round of question first through Dr. Lesh and Professor Lee, and then Dr. Low, and finally Dr. Lee from ICDF for one question each. I would like please ask you to limit your answer in a very concise but rich answer of 2 minutes. So first of all, I would like to address the question from Jung, I guess, given the name from Korea, who is asking about the long-term role in fighting the pandemic and the post-pandemic era for civil society as well as private entity in the public health sector. So what would you be the answer? What would be the major role that the companies like yours in hand with civil society could deliver in tackling the impact of this pandemic in the mid-long-term era? Dr. Lesh, please.
Thank you very much for the question, and I think there's a very wide range of roles for public sector and private sector. I think I could just speak to our role as a digital development organization, and we are here. We were here long before this pandemic, and we'll be here long after the next. And so our role is just to provide the most effective, most cost-effective solutions to the widest set of governments that need them, and to respond to the needs of the workers, to provide information and to keep them safe, as well as to work with governments to figure out what are the deployment models of our digital solutions that could best affect their strategies. I hope I understood the question, and that's my short answer.
Thank you so much for, I think, the rightly answer. I mean, it's a very wide range of things that we have to cover indeed, and I think we have a lot of to do, rather not lack of things to do. So now jumping to Professor Lee, we got multiple questions from the floor, but I would like that it would be very interesting to address this question. Could you share any experience from your side as an expert in both international and Korean public health, the health response to COVID in developing countries supported either by Korea or by international society, especially in the domain like the trackers or the district health information software? Do you have any knowledge about such an online system that has been contributing to fighting COVID in the developing world? Professor Lee. Microphone, please, Professor Lee.
As for the Korean support, there had been some of the health information system establishment support. In Bangladesh, there had been, and Nepal, there had been DHIS2 health information system support. And indeed, through Good Neighbors, there had been mobile DHIS2 distributions. This was not specifically for COVID-19, but I think it had been connecting the frontline healthcare facilities to the health authorities in terms of collecting health information systems and managing the local health system. But more of the Korea support has been in the area of diagnostic capacity support, especially testing and diagnosing the disease. At the same time, supporting healthcare worker for the protection of frontline health worker with PPE and more of the protective equipment and materials.
Okay, thank you very much for your concise answer as well as sharing that information, which is really useful. Now I would like to, jump to Taiwan and would like to ask Dr. Lo about, you have been sharing with us a lot of dimension about the experience that you have in Taiwan. And I think that's a very good best practice that can be shared with other countries. And how do you have, as a government of Taiwan, have plans to contribute to build resilience for COVID and post-COVID affected population in developing country? Dr. Lo, please.
Yes, although Taiwan CDC is in charge of mainly domestic disease prevention and control, we do partner with stakeholders like ICDF and other foreign aid institutions to contribute our experiences and technology to countries that are, partner with us, so we can share not only exchange our experiences, but also learn from experiences of other countries. For example, at the moment, we are experiencing this crisis, which probably has been experienced in other countries earlier. So it's okay that we share experiences and learn from each other. And our advantage, I think, is our information technology aspect. So we have a lot of IT experts that will be willing to contribute their skills and also knowledge to affected population in developing country most. But also our traditional public health approach is also useful in establishing, the resilience of those countries in recovering from the pandemic, because it took time to pay for the future. But if you start to prepare, you will little bit by little be more and more prepared for the next pandemic. And it's never too late to start preparedness. That's the most important lesson learned from Taiwan. Thank you.
Thank you very much. Both in case of Taiwan and Korea, you have been sharing how, the preparedness that you have been, building up SARS has been helping in tackling the COVID issue, shows very good example to the world. And I think that those experiences in link with this software platform that were developed by Dr. Lash can be really helpful for the global health protection for the next pandemic. Now, last but not the least, I would like to address a question to Dr. Paiko Lee concerning the role of TaiwanICDF. You have been already sharing about different public health projects that you have been doing with other country governments, but there is this question from the floor that asks, are you planning to do also some online courses for healthcare workers based on the Taiwanese experience? Do you think that you could do webinars or such a kind of session online for the people to fight COVID? Microphone, please, Natalie, microphone, please.
It's okay?
Yes.
Microphone?
We can hear.
Yes. Okay. So yes, we TaiwanICDF are working with several Taiwan medical associations and hospital to establish online training courses for health and care workers. For example, we are working with Taiwan Society Nephrology on kidney disease basic training courses. Thank you.
Okay, thank you to that. I see it also two other beyond case. Now that being said, it's time to wrap up. I would like to thank all the speakers, Professor Lee, Dr. Lo, and Dr. Lesh for contributing your expertise through this platform. I would like also to thank the audience. I had questions from America, Latin America, also Europe that were posted, and I would like to thank for all the attention that the audience paid here. And finally, would like to thank ICDF as well as Good Neighbors and Dimagi for organizing this appreciative event. And I think this will be also a platform for future collaboration among the stakeholders who are present here today. So all unanswered questions today will be replied in written in the very near future by ICDF. And beyond that, I would like to wish you all to stay safe and well. And thank you very much for all. Goodbye.
Thank you.
Thank you.
Bye.